Sugar Talk is brought to you by Diabetes and Endocrinology Consultants, and Dr. Lucas is in the house. Good morning, Doc. How are you?
Good morning. Great.
Good to have you with us here today. So what are we talking about today?
We're talking about the ups and downs of diabetes.
And the ups and downs meaning blood sugar.
Blood sugar,
right?
Of course.
Yeah. So what do we want to know here? I mean, when it goes up, when it goes down, how to time it, or what?
Well, I think what people need to understand is that people that don't have diabetes, their blood sugar stays the same, no matter what they eat or what they do. And people with diabetes don't have that luxury. So they have to sort of figure out what's really making it go up, because every time it goes up, it damages your body.
So you have to keep track of it, obviously.
Yes, but also you need to be aware of, and everybody knows what makes their sugar go up, I think, at least food. They try out different foods and experiment to see how high their sugar goes afterwards. Sometimes they don't check it right after they eat that food, they check it the next morning and it's higher those days. So the things typically that make your sugar go up would be, sugar.
Obviously.
Obviously, sweets, desserts. But what some people don't realize is that starches, complex carbohydrates, which are supposed to be good for you, make your sugar go up also. So if you eat spaghetti, pizza's a big one that makes your sugar go way up overnight.
Well, Dr. Lucas, we're also in strawberry season here. Does that do fruits?
Yeah, I think the quantity makes a difference. Some fruits are better than others. Now, bananas will make it go up if you eat them by themselves, or grapes, or watermelon, pineapple. Those are the fruits that have a lot of sugar without fiber. If you eat an apple, it's less likely to make it go up as quick because you have a lot of fiber in it. So if you're spending a lot of time chewing up the fruit, and berries go under that, as far as chewing up. That doesn't mean that you can eat as much as you want, but a serving size, which would be one apple would be a serving, or about a half a cup of strawberries would be a serving.
So sitting down with a flat of strawberries that comes from the garden center probably is not the right idea.
It's still going to make it go up. I mean, quantity is important. Just because the food is good doesn't mean you can eat as much as you want, and that's part of the problem. So foods make it go up. You can check to see if your blood sugar has gone up 1 hour after eating to see what it's gone up. If it's under 140, it's really good. So that's what you aim for. The American Diabetes Association says you can have up to 180 2 hours after, but if you really want to keep it controlled, 140 is a better number even after eating.
You mentioned a banana by itself. Is there something that can mitigate that?
Well, it depends on what you eat it with. Because if you eat the banana with peanut butter, that's going to blunt the effect of the sugar. If you eat the banana as a dessert after a meal, that's going to work out good.
If you eat the banana on your cereal.
No.
No.
The cereal makes your sugar go way up very quickly because it's sort of liquid starch that gets converted into sugar in your mouth, and then the banana just adds to the sugar. So that's probably the worst meal.
Okay.
Probably not the worst, but it's pretty close. Cold cereal.
The dozen
like
donuts
that.
might have been worse.
Now you might try the banana in oatmeal, the regular oatmeal that you actually cook, or you can get the pre-cooked regular oatmeal, but not the instant, because the instant doesn't have as much fiber. But regular oatmeal with the banana will mitigate the effect of the banana. So the best way different people are different with oatmeal, so the best way is to check it an hour after to see if that's a good meal for you.
Well, and that's the whole thing, is to keep checking your blood sugar at the right times. An hour
Right,
after
if you really want to experiment with different things, some people are surprised their dessert doesn't make the sugar go up, but it's because they eat the dessert right after dinner, which they already have a bigger meal, and it just doesn't get absorbed as fast. But if you eat ice cream by itself, it might make it go up quicker.
Well, on the other hand, what about what makes sugar go low? What makes it go down?
Well, if you don't eat, like if you take your medication, which is not usually a problem, but say you're sick and you just don't eat, but you take your usual medicine, then your sugar could go down. When you're sick, though, you don't want to skip all the medicine because sickness makes your sugar go up. So being sick or stressed or not feeling good can make your sugar go up, so you really don't want to avoid taking all medicines. You want to keep a check on it, especially if you're on insulin. You want to keep a good check on it when you're sick, because you may need the insulin even though you're not eating. But in general, if you skip meals and you're taking medication that works the whole day, then it's going to have a tendency to go down.
If you're sick in a way that requires a steroidal medicine, do you have to work that out with your doctor?
Yeah, if you have a sinus infection or asthma and you have to take prednisone, which is the typical one, it will make your sugar go really high, like 300 or 400. And if you're on pills, then you have to check with your doctor about being on either more of that same pill or on insulin. Sometimes you have to go to insulin when you're on prednisone. That's only for a week, but you know, you don't want your sugar to go to 400 for a week because you're not going to feel good. So you have to watch the prednisone. I think a lot of people are cavalier, just give prednisone for sinus infections and things like that you may not need the prednisone for.
Now, can exercise make your sugar go down?
It can, but it doesn't necessarily make it go down right that minute. So some people, it actually goes up a little bit right after they exercise because your muscles are working and releasing stored sugar. So it's releasing stored sugar into your bloodstream, so that may make your sugar up temporarily. Then the muscles have to replace that sugar, so up to 24 hours later, you can have a lower sugar. So you have to watch it. Everybody's different as far as when their sugar might start dropping after exercise. That's why it's important to sort of start the exercise in the morning, so you have the whole day to sort of figure that out when the blood sugar is going to drop. So everybody thinks it's going to drop immediately when you exercise, but sometimes it doesn't.
So for the diabetic who goes maybe after work and goes and works out or exercises.
Yeah, I think the first time you do it, you may want to do it early and sort of get an idea. If you go after work, it may drop in the middle of the night, but some people it's just not that crucial. Some people with type 2 diabetes that only take medicine, pills, it doesn't tend to be as bad as the insulin people.
Well, now why is it high in the morning? I mean, if you've been fasting.
The liver makes sugar all night. That's what the liver does. The liver provides sugar for the brain and the rest of the body while you're asleep and you're not eating. But the liver is sensitive to insulin, and if you're resistant to insulin, insulin's supposed to keep the liver from making sugar, and you make a little bit of insulin all night to keep the liver from making sugar. But if the liver doesn't pay any attention to insulin, just whatever it wants, it will make sugar all night. It'll make a lot of sugar. So a lot of times you'll wake up. Now that's one thing. However, the main reason for it being high in the morning is that it's high when you go to bed.
Oh,
so if you pig out at night, eat all night, and then why is it high in the morning? It's because it was high when you went to bed and it was higher when you went to bed. It's actually come down, but most people don't want to check it after supper or at bedtime because, it can be really bad.
So
it looks bad.
Is eating late in the evening, is that bad for you too in terms
well,
of
it makes your sugar stay higher through the night, and that's true. Some people you can tell when they've eaten late. They've checked it before they ate, and they've eaten like at 8 o'clock at night, and they ate a lot of food, and then it stays up overnight. So you have to factor all these in. You don't want to just treat a morning blood sugar because it's high. You want to get to the root of it. Is the root overnight your liver's making sugar, or is the root of it that you ate too much at night?
Gene Lucas from Diabetes and Endocrinology Consultants. And Dr. Lucas, just curious, we're talking about blood sugar, what makes it go up and what makes it go down. Well, why are we sleepy after eating? Why do we want to take a siesta after lunch?
Well, everybody wants to take a siesta after lunch because that's just when your body rhythms go down.
Well, we've been putting in for a nap rhythm around here. We'd like to have one.
Yeah, the Mexicans have it right, I think. No, if you feel sleepy within an hour of eating, so right after eating, some people call it a food coma. If you go into a food coma, it may be because your sugar's too high. When your sugar goes high, your body can't use that sugar for energy, and it just makes you tired and sleepy. Sometimes you feel flushed or hot, so it's not really a hot flash as much, as far as women with their female hormones, but it's a blood sugar elevation. So keep that in mind if you eat a lot of spaghetti or pizza or cereal even. If you feel hot or feel tired, then your sugar may be going up and you should probably check it.
So that's not a good idea to take a nap after eating?
No.
You should be
You need to be walking around, especially if there's certain foods that make you sleepy, that means your sugar's going up, or you've checked your sugar and make sure you immediately need to finish your food, walk away from the table, and go for a walk. Walk away from food, so that your walking helps your blood sugar eventually. It may help it right then, keep it from going up. So that's a good way of doing it.
Does quantity of sleep affect your blood sugar?
Yes, it's a stress on your body if you don't sleep at least 6 hours in a row. So some people sleep 6 hours, but it's broken up every 2 hours, so that's not good sleep. A sleep cycle is 4 hours, but 6 hours is probably a good amount of sleep as far as helping you lose weight, because you won't lose weight if you sleep under 6 hours. So, but any kind of stress on your body can make your blood sugar elevated. Also, if you're stressed, you don't tend to check your sugar as much, you don't pay attention to what you're doing, you tend to eat out more because you don't feel like cooking, and so all those things contribute to a higher blood sugar.
So it's time for everybody to get up and take a walk.
Yes,
right
after breakfast.
There you go. All right. Once again, if you want to find out more about diabetes and endocrinology consultants, you go online to beachdoctor.com. That's beachdoctor.com, and join us next week for more Sugar Talk with Dr. KJ Lucas. We'll see you then.